started your timer and here is your question. Right, so if you have read and understood, considering a clinical examination station, kindly please begin.
Okay. Hello, good morning.
Yes, good morning, but patient may not reply you.
All right. Hello, this is Dr. Malik from the surgical ward. Hi, sir. How are you? How are you doing?
Patient is nodding, saying yes, not
Okay.
answering.
Okay. Can I get your name, please, to make sure that I'm speaking to the right person?
You'll confirm the name yourself from the band.
Okay.
Yes, Tom, 55
Okay.
years old. Yes, continue, please.
All right, Tom. Tom, my sister has told me that you've been feeling poorly today. Is that right?
Yes,
Okay. What's going on with you?
I've got sudden onset of chest pain. I
All
can't
right.
breathe.
I'm so sorry for that. So I'm going to put this oxygen on your face, to help you. Okay?
Okay.
All right. How is it now? Much better?
Yes.
Okay. So the main reason I'm here today to have to examine your chest. All right?
Okay.
Yeah. But you clearly, obviously, you look so distressed.
Yes, I am.
Okay? Yeah. So I would like just to do to check on your breathing and check on your chest movement, and I will listen to your chest, if you wouldn't mind.
Okay.
All right. I will start by inspecting the patient, expose my patient, and ask my nurse to prepare a fresh news observation chart for me. Okay, so I'm looking at the chest. Okay. Yes. How
Since
can
I can't see, so you have to tell me where would you stand and
I
how
will
would you
stand at
be
the patient? Yeah.
observing and how much exposure you have done. What is the position of the patient?
The patient, I will be expecting the patient is lying flat and he
Not
having a cone.
necessarily.
Because
Yes.
okay,
Maybe
having a
patient is,
cone.
yes. Sorry, not
Okay,
necessarily.
no problem. Should I explain everything,
Yes.
situation, and make it like real?
Yes.
Okay, so I will be standing at the patient end.
Yes.
Okay, and from the part of the leg. Okay,
Yes.
and will be looking at the patient,
Yes.
exposing his chest up to the groin area.
Okay.
Okay, and I will be starting to inspect the chest movement.
Yes.
And how the patient is feeling. Is he distressed or not?
Before
I will
movement, you're
obviously
looking at the scars, if there are any scars or if there are any
dilated
deformity or
veins,
yes.
any deformity scar, dilated veins,
Yes.
any sternotomy scar or mid-clavicular scar, or sorry, infraclavicular scar. Okay,
Yes. Yes.
and after
Yes.
that, yes, the patient will be in pain, really. So I
Yes.
will check him. Are you okay, Mr. Tom?
No, I'm not.
He's not okay. I will turn into my examiner and tell him my patient now is feeling poorly ill. I would like to shift my chest examination into a crisp examination or critical care of the
Okay.
crisp examination. He will say, okay, proceed. I will say, I almost commenced an oxygen. Now I'm going to check on the breathing. I will ask my assistant to attach a 3-lead ECG for me, okay? And to attach the oxygen saturation observation, pulse oximetry. And after that, I will be on the chest. on the right of the patient. Okay, I will be looking for the respiratory rate, ideally for 1 minute. And after that, I will put my thumbs together to check for the chest movement equality in 3 times. Xiphisternum and inframammillary and on the top. After that, I will do my palpation by checking the trachea, if it is deviated or not. I will go through the ribs one by one and the clavicle quickly to make sure no tenderness or any susceptibility of injury. Finishing my palpation, I will start doing percussion, starting from the clavicle and go for 3 spaces. So 6 areas, I will be percussing 6 areas. Finishing that, I will ask immediately for an intervention in the B, which is a chest X-ray and ABG. I will be reading and commenting on the saturation at the same time. I will expect my assistant to say the patient's saturation is picking up, okay? And then I will go for the circulation. I will check first for everything. I will be explaining everything while I'm going through. I will check the pulse and blood pressure, capillary refill, and peripheral temperature. Okay, and after that, I will decide to give the patient a bolus of fluid. Okay, and go for the D now. Disability. I will check the 2 pupils and the AVBUL. Okay, and after that, I will ask for a glucose concentration, blood glucose measurement. Finishing that, I will expose my patient or offer to expose the patient. I will be expecting the examiner to say, do not touch the patient, maybe, or do not take the plaster out.
Okay, can
I
you
then-
please summarize your examination now?
Today, I've seen Mr. Tom, who is obviously distressed, having a central chest pain. Okay, 8 days following his right hip operation. He is distressed. His respiratory rate is 26. His oxygen saturation on arrival was 88, and is picking up after 15 liters of oxygen. There is no obvious evidence of any trauma to the chest. Okay, according to this all clinical feature, my professional diagnosis for Mr. Tom is susceptible pulmonary embolism. I would like
Okay.
also to consider myocardial infarction, perforated peptic ulcer, or pancreatitis, or pleurisy.
Okay, what investigations would you do to confirm your diagnosis?
Okay, to confirm my diagnosis, first of all, I would like to withdraw blood for full blood count to check on the hemoglobin level and to check for the for the inflammatory markers, and liver function test, renal function test, and we'll do cardiac troponin or cardiac enzyme profile. I would also check in for the white blood cells to check if there is any pneumonia or not. I would like to ask for a D-dimer if possible, okay? Then I will go, escalate my
All
care
right.
to ask for a CT, and CTPA.
Yes. To
Okay.
exclude pulmonary embolism. All right, good.
Exclude
Can you tell
pulmonary.
me how would you manage the patient's pulmonary embolism?
Okay. Managing this is for this patient or in general? In general, let us start with this patient. In this patient,
for this particular patient, please.
yeah, for this particular patient, this is clearly Mr. Tom is not suitable, okay? And there is a possibility, a greater possibility that he can went to cardiac arrest. He can go to cardiac arrest. So I would call for help first and ask for the ITU and the medical team to come, and then calculate and give him a fluid bolus, give him a pain killer or to control the pain, and decide the heparin according to the recent renal function test, okay? And start my interim therapy according to my Wells score, which is more than 4.5 in this patient, okay? After that, I will escalate my care further and ask my consultant for this patient, advice, and I will keep him informed about it. Having a look at the patient notes and the previous charts, and decide for the plan. Okay, and most likely this patient is unstable.
Most
he will
likely,
be
but may not be.
Hmm?
If you were scrubbed and
Hmm.
your subordinates comes and informs you about the patient's condition, what would you do?
Yeah, this is a crash call, immediate crash call.
Good. Okay, thank you.
Is it finished?
Yes.